Meet Terry. She is an emergency room nurse in Phoenix, Arizona. She cares for all types of patients, each with different health concerns, but they all have one thing in common. Terry's patients live in a dry, hot weather climate. Typical summer temperatures rise above 110 degrees. Each of Terry's patients, independent of their health status, are at risk for dehydration. Unfortunately, hydration is such an obvious issue, it is often overlooked. How many of you have seen dehydration when it could have easily been prevented? In the inpatient and long-term care settings, dehydration has become a greater problem than malnutrition. In the outpatient settings, dehydration worsens the symptoms and prognosis of acute illnesses. Terry recognizes this problem and wonders how can she proactively prevent, recognize, and treat the symptoms of dehydration in her patients. The human adult body is approximately 70% water. We are constantly losing water from our bodies, primarily via sweat, stool, urine, and breathing. Along with water, we lose small amounts of salts or electrolytes. Dehydration occurs when the amount of water lost exceeds the amount taken in. Dehydration can lead to increased thirst, increased heart rate, fatigue, headaches, dizziness, dry mouth, and confusion. Severe dehydration can lead to death. As often with medicine, prevention is the first step to treating dehydration. Dehydration is treated with fluid replacement. Typically, oral hydration is preferred if the patient can tolerate it. So how much water do Terry's patients need to drink to avoid dehydration? Health authorities have commonly recommended drinking 8 8-ounce glasses of water a day. This is called the 8x8 rule and is very easy to remember. However, Terry realizes that as with most things, adequate hydration depends on the individual, and there are many factors, both internal and external, that affect our need for water. With so much variation, patients should be educated to recognize simple and standard approaches to hydration. Terry instructs her patients that we should all trust our thirst. Evolution has provided us with this mechanism to regulate when and how much we drink. If our total water content is low, we experience thirst. The thirst instinct is very reliable, having kept humans alive for a long time. More than understanding simple thirst commands, it is important for patients to know that certain circumstances may call for increased water intake. These include times of increased sweating and thermoregulation, such as during hot weather and exercise. If you are sweating a lot, make sure to replenish the lost fluid with water. If someone has had significant fluid loss, electrolyte solutions should be incorporated to maintain the proper electrolyte balance during rehydration. Breastfeeding moms also have an increased need for water, as do patients with disease states such as diabetes, fever, infections, vomiting, and diarrhea. Other special circumstances involve patients with age considerations. Older patients need to be more mindful of their water intake because some studies show that the thirst mechanisms start to malfunction with age. Younger patients may rely on adults to provide them with the hydration they need. Drinking alcohol or caffeine can lead to dehydration, just as not consuming enough fruits, vegetables, or electrolytes can. Terry knows that a quick way for patients to check for hydration status is to look in the toilet bowl or diaper after they have gone to the bathroom. If the urine is clear or very light yellow and has little odor, they are well hydrated. The darker and more aromatic the urine, the more dehydrated they are. Terry sees how important the nurse's role can be to proactively educate and treat patients with dehydration. How can Terry's patients consume more water? In the hospital setting, she frequently provides water, reminding patients to drink. In the outpatient setting, she often recommends that they carry a refillable bottle with them to drink throughout the day. Other ideas include keeping water at one's desk and next to the bed, switching one glass of soda or coffee for a glass of water, and eating fruits and vegetables with high water content. If someone has had significant fluid loss, electrolyte solutions should be incorporated to maintain the proper electrolyte balance during rehydration. Terry finds great satisfaction knowing that she can directly improve the health of her patients. She positively impacts lives of her patients by providing these simple educational interventions. What are some things that you can do in your own practices to help prevent, recognize, and treat dehydration?